Good evening and welcome to our tele-townhall. We appreciate you taking time to join us. We are having a town meeting here to talk about the election that's coming up here on Tuesday, where Henry County voters will be deciding whether or not to authorize the Henry County Health Center Board of Trustees to proceed with an operational lease agreement between the center and Great River Health. And we wanted to take this opportunity to make sure that voters had the chance to ask questions to the people that have been involved and to try to get the information out so we can just have a real good, candid discussion about things, and everybody can head into Tuesday with the information they need to make a decision. And so joining us tonight, we have two special guests that will be helping to answer these questions as we go through. And I'm very happy to have with us Towne, who is a member of the HCHC Board of Trustees. Jan?
Hey, thanks for having us tonight. It is important to get these questions out, so I'm looking forward to it.
You bet. Thank you, Jan. And we also have with us the CEO of Great River Health, Matt Wenzel. And Matt is looking forward to being able to talk tonight. Matt, you just want to go ahead and get us kicked off with some thoughts about the election on Tuesday?
Yeah, thanks a lot, John. So appreciate everybody's time dialing in tonight. This is an important vote coming up on Tuesday. And respect to everybody that is jumping on and trying to find out the information, because that's what we're trying to do tonight is deal in facts. And we're going to welcome questions. Hopefully we can get you the answers to that. And to start off with is...
And Matt, I just want to say on those questions, I should let folks know that to ask a question, they just need to hit *3, and then they'll be placed into the question queue. So as you're speaking, people can go ahead and preload on their questions if they'd like by pressing *3. Thank you.
Yeah. So thanks again for everybody joining. Questions I hear about is why now? And Jan and I could probably hit on that. And I've used kind of a silly parallel is that we're all on the plane together tonight, and we want the plane's flying altitude to be 35,000 feet. Well, it's dropped to 20,000. And we want the pilot to figure out how to get that plane back up to 30 to 35,000 feet when it hits 20, not when it gets down to 5,000 or worse. That's what we're trying to do here, is that stabilize healthcare in the community. And if you look at the facts, and Jan, she will talk, she's an accountant. She looks at these things, is that a few big ones that stand out to me is if you look at the tax, and if you talk to the board members, you talk to the CFO, Dave Muse, is he would say is our hospital, Henry County Health Center, was at the bottom third in tax levy 5 years ago. It's top third now. Two is you look at the FTEs, full-time equivalent, jobs, people, our employees that live in this community, and how many we had a few years ago and how many we have now. It's gone down. And services that have been lost. All while is that our cash that we're using to pay for all these services is going down. We got to do something. And so is that hope isn't a strategy, and we're trying to figure out, and we have, and worked over this over the last year on how we're going to get the plane from 20,000 back up to 30 or 35,000. That's what the vote's about on Tuesday.
Thank you, Matt. I think that's a good explanation. And Jan, would you have anything that you would like to add to that as we're asking folks to go ahead and hit *3 to ask questions and have a dialogue here with a couple of the principals in this decision about the election on Tuesday?
Absolutely. I guess first I'll give maybe just a little bit of background of myself. I was actually born and raised in Wisconsin, but I've lived in Mount Pleasant since 1986. Raised 3 kids here. I have 12 grandkids, 8 of which are local. So healthcare is absolutely a huge concern for me. I've been on the Board of Trustees since 2004, elected by the residents of Henry County, and I take that very seriously. I really enjoy my time on the board, and as Matt said, I think right now with healthcare changing the way it has been, we just really wanted to be forward-thinking and go into something before before it was serious, before we had our back against the wall. So we're excited about this partnership. I see lots and lots of good things coming and look forward to all the calls tonight.
Once again, just to be able to ask your question, all you have to do is hit *3 and we'll get you placed into the call to ask your question. Matt Wenzel, the CEO of Great River Health, and Jan Towne is the Henry County Health Center Board of Trustees. So Jan, maybe while I see some folks are in the midst of getting their question asked. Here we go. I was going to ask you a question, but I'm going to go ahead and place one in here just a moment. Looks like we have Ryan calling in, and Ryan, I think your question is about a little bit more on the impetus for this decision.
Sure. I would love to answer that. This is something, as I said, I've been on the board a long time, 2004, and probably one of the main jobs of the Board of Trustees is to oversee the hospital, to strategically place it to where we can continue to offer health care locally. And the board meets monthly. And this particular decision of, moving ahead with this lease with Great River, we've been working on this for about 18 months. So, despite what some people have said, it's kind of surprising to me that some people think this has come so quickly, because believe me, this has not come quickly. We have been working on this together for a long, long time. And it does come, as I said earlier, from a position of strength, but knowing that with healthcare changing the way it has been, we don't have the luxury of doing what we've been doing with no change. It's just not an option. So this was a way that the board saw to keep healthcare local, to keep healthcare, in Southeast Iowa, and also to keep the oversight of our current board, which we may not have had with other options.
Thank you, Jan. And it looks like we have a call here from James, who wanted to ask you about if there were other options. James, go ahead.
Hey, I just had a question about, were there any others that were really looked at, any other hospitals that might have come directly to you to say that you might have been able to work with them? I was just curious about some of the thinking and the process behind Great River.
Absolutely. Logical question, quite frankly. And I can tell you, and most of you do know, that we have had working relationships with the University of Iowa Hospital. We've had working relationships and continue to have working relationships with them, and Mercy as well. But it was the board's goal to have more oversight and more local control. And we just, those options were not as appealing to us because we would have lost that local control. And keeping healthcare in Southeast Iowa was really key for us.
To add to that this is Matt James, Great River Health, our philosophy is a little bit different than what we see at other systems, and that is that we're not in the business of creating franchise. That works in fast food restaurants, whereas you order a number one and you're going to get a number one every time. We're dealing with people and we're dealing with lives, and who best to determine that than local people? And I think that really helped the local board. And to prove that out is that we're going to continue to have a local board of trustees that are overseeing this hospital, and also at Great River Health Board the Henry County residents will have representation on the Great River Health Board. So I think that was appealing to the Board of Trustees.
Thank you both. And we have a call here from Doris. Doris has a question about the agreement and about, I guess, the private nature of the agreement. I'm going to plug in Doris here. Doris, go ahead. You're live.
This is Doris Berlio, and I don't mean to be insulting or anything, but I just wondered if the Board of Trustees were able to read the lease agreement. I understand it's like a 40-page document, and it's private.
Hey, Doris. Wow. That really catches me off guard. I know there's been a lot of talk out there about the lease being private, but absolutely, the board has not only read it, we have been working on it for 18 months. This has been a collaborative effort. This is nothing, believe me, this is not something that Great River has shoved down our throats. I mean, this has been the two organizations working together for a long time, and every single member of the Board of Trustees has not only read it, but has had input into that lease.
Thank you, Jan. And I'm going to plug in Terry, who looks like is in the medical business. Terry, you're live?
Yes, I was just wondering, my provider is at Family Medicine. Since the hospital is going to take, they will control of all that, and Henry County has their own physician, will they ever come to a point that they don't want to renew the lease with Family Medicine, and then my provider would have to find new space? Are they going to be able to stay there?
Yeah, it's a great question because, and your level of understanding is high on this because you're right, is that they lease space from the hospital now, and they will continue to lease space, and we have no plan with this transition. In fact, it provides more stabilization because that's what this is about, is stabilizing healthcare in the community. So we at Great River have no plans on terminating it. In fact, is that to answer your question directly, is that they've got, I think they just signed up for a 4-year lease agreement that will continue on. Yeah, we want to work with them and don't see any changes because of this other than is more security.
Thank you, Terry. And now we're going to be going to Lynn, who has a question about Tuesday's election. And Lynn, you are live.
Okay. I haven't heard or seen anything in the paper about where you're supposed to go, other than prior to Tuesday, you went to the county courthouse. But on Tuesday, where are we supposed to go vote?
Well, I can answer that, at least for Mount Pleasant, but really all of Henry County, it's the normal polling places. So,
okay.
If you live in the city limits, it'll be
at the high school, the old high school.
No, honestly, it's changed. It's at the VFW, right?
Oh, really?
Well, Jan, I could jump in here on this. What I can tell you is that the polls are open on Tuesday from 7 a.m. to 8 p.m. And the polling locations are on our website, on the campaign website at HCHC.org. And also, Lynn, you can always call the county auditor's office. If you have a pencil handy, it's 385-0756. And they'd be more than happy to answer a question for you there. But the polling locations are included at the website, HCHC.org. And they're directly just pasted in from what the auditor has put out there. And you can call the auditor's office at 385-0756.
Hey,
I should note also, you can still vote on Monday at the courthouse between 8 a.m. and 4:30. But on Tuesday, you got to go to the poll.
Right.
I did confirm, by the way, that Mount Pleasant City, all 4 precincts are at the VFW. And then outside
that's at the old police station?
It is, correct. Yep, you got it.
Okay, all right.
Thank you, Lynn. And let's see, looks like we're going to go to Kelly, who has a question about the maternity ward. Kelly, you're live.
Will this help bring the maternity ward back to HCHC?
Well, I mean, I'll start, and I think Matt and I can probably both answer that. This was probably one of the most difficult decisions that the board made, was to close OB. And, I am an accountant, and unfortunately, OB is just, it was a huge money loser for us, and we tried. We tried for a couple of years. I was probably one of the staunchest supporters for keeping OB, but it just became very clear that fiscally it was just not a good decision to keep it. So it's a great example of how the two organizations work together, because the midwives who had been delivering babies here receive privileges, and they can continue to deliver babies at Great River. So all these moms can have all of their prenatal care right here, just like they have. And they can deliver with the midwives that they've seen all throughout their pregnancy. So honestly, OB has been one of the stars in our partnership with Great River.
Yeah, I think that's a perfect example of what we can do together when you're having to make tough decisions. Is that we were able to provide a level of service that probably wouldn't have been there without the partnership. So we were glad to be able to step up and help out, and we see that just happening more and more and more. So it's a great question, and really gets to is how we can continue to stabilize healthcare in Southeast Iowa.
Great, thank you, Kelly. Appreciate the question. I just want to remind folks you can ask a question by pressing *3, and if you've joined us in progress, we have on the line with us Matt Wenzel, the CEO of Great River Health, and Jan Towne of the Henry County Health Center Board of Trustees, and we're talking about the special election on Tuesday about the operational lease agreement between Henry County Health Center and Great River Health. So by all means, please, this is a great opportunity to get your questions answered and talk about the issue. All you have to do is press *3, and we'll place you into the question queue. Right now, we're going to go to Liz. Liz has a question about Great River taking over, a question about whether or not it's taking over staffing and where she can get more information. Liz, you are live.
Yeah, actually, this is the first I'd heard about it, so I definitely wanted to tune in. But I wanted to know where I can get more information. I think I just heard the website. But in a few sentences, can you tell me what exactly is the lease about? Who's moving in? What type of authority is, where things are going to lay when that gets done?
So I think that, the website provides a great summary document, Liz, that you're going to be able to get your questions answered. I'll take a swing at it, and I'll try to be as brief as possible, but the summary itself is 2 pages, 2 to 3 pages, so I think that'd be the best. What this is about, again, is stabilizing healthcare, and how we're going to do that is and I think the other part about that I would say is the employees. I think you mentioned that at the beginning, is that the employees are going to remain Henry County Health Center employees. That was huge for them in this community. That means they get to keep IPER. So not only are we stabilizing healthcare that we can continue to talk about, and that's the driving force. I think Ryan mentioned that at the very beginning is why are you doing that? This is why. And we figured out a model to be able to continue to allow IPERs to continue with employees. I think that's just huge.
And I think from the board perspective, clearly our employees were key. And IPERs is a huge part of that. And because, any other organization, I don't care if you're talking University of Iowa, Unity Point, whatever, they're not going to have that. They're not going to have that ability. And so this partnership was giving us this private partnership, private-public partnership that was going to allow our employees to stay on IPERs. It was going to allow the current board to stay on in an oversight position. I mean, we still own the building. This is only an operational lease. They are not taking over the building. That will still all be controlled by the Board of Trustees. So this arrangement is the perfect answer to the continuity of care in Southeast Iowa, as well as for our employees.
Thank you very much, Jan. Our next caller has a question about the surgical department. And before we go to her, I want to just remind folks that you can ask your question by simply pressing *3 on your dial pad, and you'll be placed into the queue. And this is an open forum, and we're taking all questions. So please feel free to get your question asked by pressing *3. Harriet, I am placing you live right now.
Okay, I would like to know if the Henry County Health Center's surgery department will remain the same.
Yeah, Harriet, I can address that. I had a great conversation with them last week and saw all 12 ladies huddle around the desk there and ask very similar questions. And by the end of our hour conversation, I think they felt very comfortable. And if you know any of them in the surgery department, would encourage you to reach out and ask and get their opinions as well. But the short answer is they're going to continue on as is. that's where we're guaranteeing that for 4 years. So, and we don't have any plans thereafter in terms of any major changes, but not a whole lot seen, except we might be looking at growth. And it gets back to is that right now, if a patient from Danville or somewhere in between Great River is coming to Great River, if we're all working together stronger, is that if they come over here for surgery, that's great. So, in fact, we may be able to see a growth in that department.
Thank you, Harriet. And I have a question that was left here for us. This is from Jerry, who wanted to ask a question about who's paying for the campaign for this election, and is taxpayer money being used? So I think probably both Jan and I could address that, but the short answer is tax dollars are not being used. It's split between Great River and Henry County Health Center. And if you look at the way tax dollars are used, over 85% of that are used on the employees, IPERS, and also is FICA. So none of the dollars are being used for this purpose.
That's absolutely right. Can't really add much to that. We're very limited in what tax dollars can go for, and rightly so. The board of trustees is very aware of our responsibility to all the residents of Henry County.
And another question here is, has FMMP, I believe that's the family medicine practice, been part of the process? How does this affect them within Mount Pleasant?
So, and Jan, jump in whenever, but I think it goes back to a question we got a little bit ago is that they lease space from the hospital. They will continue to lease space from the hospital under the new agreement as well. So they really won't see much impact, if at all, except for continued stabilization of healthcare. They were one of the first groups that when the Board of Trustees came out of the negotiations, they were one of the first groups to be notified of what the Board of Trustees and Great River Health will do.
I think maybe the only thing I'd add to that is the fact that the family medicine docs are really not employees of the hospital. And I know that's probably surprising to a lot of people, because you know what? It was kind of surprising to me, a long time ago when I first became active on the board. I think it's just sort of assumed that all the doctors are employed here, but that's not the case. They are all independent, and they do lease the space. And it is certainly our hope and our goal that, they will be part of this, they are part of it. They are part of this partnership. We're all going to work together to make sure that healthcare stays local.
Great, thank you both. And let's see, I have a question here from Kent, and Kent is asking, how does this affect EMS? There have been changes with EMS this past year.
Well, I'll start, and again, Jan, chime in, is that this was extremely important to the board as we were negotiating. And through this process is that we understood the concern, we being Great River, about stabilizing EMS services. So one of the things we did to, I'll say, get the ball over the goal line, because Board of Trustees just did a great job of representing not only employees, this community, but especially EMS. So we were able to take this opportunity and a vote yes. What's going to happen is that Great River is coming to the table with over $1 million over the next 5 years to help stabilize EMS. There's been a lot of discussion about the concern with that in this community too. So that's just another benefit, and I would say it's the cherry on top that is part of this agreement.
And the accountant in me is going to talk a little bit here. The reimbursement rates, it's very complicated, and frankly, I don't understand everything that goes into the reimbursement rates from Medicare, Medicaid, even Wellmark. But EMS is not considered an essential service, as odd as that sounds. And it has been consistently a huge money loser for the hospital. And what we found out, it was one of those aha moments in this little negotiation over the last 18 months is we actually came up with the idea of the existing board keeping EMS separate, not having a part of this operational lease that we're talking about, because through doing that, we have every reason to believe that our reimbursement rates will go up. And we will be able to stabilize EMS going into the future. And then, as Matt said, this cherry on the top, they just said, you know what, if the reimbursements still don't quite do it, we're hopeful that it will, but if it doesn't, they're willing to backfill and make sure that we can stabilize EMS here. So, again, just one more example of a wonderful partnership with a great partner.
Let's see. I want to remind folks that to ask questions, all you have to do is hit *3 on your phone. You can ask a question of Great River Health CEO Matt Wenzel and HCHC Trustee Jan Towne, who are taking questions about Tuesday's vote, the special election on the approval for the Board of Trustees to proceed in a partnership operational lease agreement with Great River Health. And I have on the phone with us Joe, who wants to hear both sides of the issue. Joe, you are live.
Since I've been listening, all I hear about is good things about this. I just wonder if there's any downsides to this agreement.
I struggle to come up with the downsides. I would tell you, Joe, is the downsides would be is that if you're not concerned about taxes continuing to go up, if you're not concerned about services and jobs being lost, and if you're not concerned about ultimately cash going out the door and kicking the can down the road and making a decision later. So I think the biggest concern or the flip side of this is that change is going to occur. It's just a matter of when and what's that look like. And if we can do it now, we can get the plane back up from 20,000 to 35,000. So really is I think the flip side of it is just change and emotion and fear of change.
Yeah, I completely agree. The horizon with healthcare, the horizon right now is unknown. It is changing literally so quickly that we cannot keep up. So there is a fear of the unknown. Completely understand, that is what people are feeling. That's what the trustees have been dealing with, which is exactly why we've decided that this is the best way to go. I mean, we needed to make the decisions early. We needed to set up the partnership and create this Southeast Iowa partnership. I keep saying that. I know I'm like a broken record, but, it really is the way I look at it. It's a partnership to strengthen healthcare in the region. And I think the only real downside is the fear of the unknown. And you know what? I think there's a whole lot less fear going into this partnership than there would be if we did not.
Yeah, I'll add to that real quick is that the CFO for your hospital, Joe, Dave Muse, and he's been here for 20 years probably, I think longer than that. Dave, if you're on the phone, sorry, buddy, I'm kind of quoting you here, but you should have seen last week is he was just excited about the future, and I think you should have a lot of comfort in that because he's like, Matt, the last 5 years we've seen and we've just had to keep going down, and now we see that we're able to do something to stabilize and grow and move forward. So I think it really gets to your question, Joe, of what's the concerns is it's the fear of the unknown and change, but the reality of this thing is that change is going to happen, and we think this is the best way to do it.
Thank you very much. I have on the line, first I want to remind folks that all you have to do to ask a question here is hit *3, and we'll get you placed into the question queue. And if you've joined in progress, we're here talking about the Tuesday special election on the operational lease agreement between Henry County Health Center and Great River Health. And we're fortunate to have with us one of the Board of Trustees members, Jan Towne, and the CEO of Great River Health, Matt Wenzel. I have Ted on the line, and Ted has a question about hospital profitability. Ted, you are live.
Yeah, I have kind of a double question. I am
all for emergency. I have done my share of emergency. I'm 81 years old, and I have probably had emergency, 5, 6, 7 times in the last 20 to 25 years. I've had heart attacks, and I've had a stroke, and I have other things. I've nearly broken a leg, and other things that I've had emergencies where they had to come out to my house to get me. And the other thing is, how do you make a profit on a hospital? Where does the money come from? I know it's going to be insurance, but how is it that you are able to actually show a profit, which I know is the money that keeps the hospital going?
You know, that's a great question. Probably the best explanation I've ever heard of hospital profitability, I'm going to give you in about 30 seconds, which is hospitals pretend to bill and insurance pretends to pay, and somewhere in the middle, the magic happens. The problem right now is that there's not enough money coming in, and so we're having to figure this out. And that's what we're doing tonight and Tuesday and what we figured out over the last 18 months. So to answer your question is that the hospital, Henry County Health Center, has a designation that helps it get higher reimbursement from Medicare. And it's called Critical Access Hospital, because that's what it is. It's a critical access hospital. And that designation is for small to rural communities. And so I mentioned at the opening is that we're competing for patients, and we don't want to, and we shouldn't be. And so if patients come here and receive the high quality services that they know they can get, it benefits us all. And so that's what we're working towards and on to get the higher reimbursement. You can only cut your way out of so much, and the hospital's been cutting over the last summer. That's what we want to stop. We want to look at growth.
And Ted, I'll address your concern too, because, EMS is so important to us. And as I said, other than the government doesn't seem to think it's essential, I think everybody else does think it's essential. But you know what? It hasn't been profitable. Bottom line, I had to kind of smile when you said, I know you've got to make a profit. It's like, yeah, I wish we could make a profit. And I'm not laughing at you. Believe me, this is serious stuff, and it's exactly why we are where we are today. But Matt makes a good point. There's absolutely no incentive for Great River to do anything with our critical access status, because the critical access status actually does get a slightly better reimbursement rate than Great River does. So, as this partnership, as the partnership develops, there will be things that are much more profitably done here. It's hard for me not to be an accountant. I've got to look at the numbers, and you know what? Any business decision says if this procedure can be done more profitably in Mount Pleasant at Henry County Health Center, then that's where it should be done. And that's the beauty of this partnership. Exactly, to try to make both entities more profitable.
And the great thing about that is the participant doesn't see any more cost. It's simply a way that Medicare from D.C. Pays more in reimbursement because of the critical access hospital.
Thank you both, and I want to remind folks that we're able to take your questions by pressing, all you have to do is press *3 on your phone, and you'll be placed into the question queue, and you'll be able to ask your question live from our two guests that we have on the line. We have Henry County Health Center Board of Trustee member Jan Towne, and we have on the line the Great River Health System CEO, Matt Wenzel. We're talking about the Tuesday election on this operational lease agreement between Henry County Health and the Great River Health System. And so I have a question here. Looks like it came in from Maria, who wanted to ask the question about why was March 2nd chosen to be the date for the special election? Seems like we're rushing into things.
Yep, I can sure take that one. Nothing magic about March 2nd other than it was really the logical time, and for a couple of reasons. First of all, again, it always surprises me when I hear people say that we're rushing into this, because we have literally put hundreds of hours into it. This has been an 18-month process, at least an 18-month process. We have been discussing this at the board level on our agenda, public agenda, for 4 months. Nothing quick about this. But the magic of March, the March 2nd, there are, and I'm not an election expert, but if you check with Shelley Barber, there were only a certain number of dates that would be available. And, March 2nd, the next would be September. Well, the hospital works on a fiscal year. And so July 1st is the beginning of the year. And we were basically going to be delaying this a lot longer than we thought would be smart by putting the vote off until September. And like I said, frankly, we've been working on this for over 18 months. It's been on our agenda for 4 months, open meeting to the public. And, it was just something that we wanted to get it done so we could put the wheels in motion for our fiscal year that's going to start July 1. Hopefully that answers your question.
Yeah, thank you very much. And I have another here. This one came in from Jerry. And Jerry asked, will the visiting specialist still see patients in the specialty clinic, or will it only be Great River Health doctors?
Yeah, I can take that. Is that the short answer is that it will continue to be the way it is. We don't want to get in between a patient and their doctor. So is that we're not going to kick people out and do anything like that. And so that's how it will be.
And what our hope is, honestly, that a lot of the specialists at Great River will add to some of that visiting specialist here.
That's great.
Yeah, it isn't that we're going to, kick anybody out from the university or Mercy. That's not the intention at all. But the hope is that the Great River specialist will come over more, which will increase the access for our people.
Yeah, and I would build on that. It's a great point. Is when we're all working together better. Is that you think about some of these subspecialists, and you need large number to be able to recruit in. Well, if we're looking at an endocrinologist or a rheumatologist, is that we may not be able to do that on our own, but when we're all working together in Southeast Iowa, we can. And then that person can then come over here and help us all out.
Thank you both. And I want to remind our listeners that they can ask a question here by hitting *3 on their dial pad, and they can ask a question of Great River Health CEO Matt Wenzel or Henry County Health Center Trustee Jan Towne. I do have a question here from a caller, Dave. If the hospital is not making a profit, why would Burlington be interested in keeping the emergency in Mount Pleasant? Where is the value? Why can't it stay in Henry County? That's Dave's question. Go ahead.
So I'll kind of take that, and then Jan, the accountant, probably can help. But first off is that to be able to have a thriving healthcare service in a community, you got to, it starts with a hospital, great doctors, and EMS. And so is that we've got to stabilize. And we acknowledge that, and the board, that was a critical piece to this. So if we're coming over here and we're going to show good partnership, we're going to talk about it, but one of the legs of the stool can't be stood up, right off the bat, we wanted to come strong and say, we're there for it. We want to help get this figured out. And to give you comfort when that question came up, because we knew it would, is to be able to say we're going to show that from the beginning, is that this is important to us, is physicians, like the questions that just got asked about the specialty services and the questions about primary care, the question about the hospital, what we're talking about, and then EMS. So we're there to help out and stabilize healthcare in this community. That's why it's important to us. And,
we'd be silly to try to tell you that, Great River is not going to benefit from this, because they are. And in any good partnership, both partners have to benefit. And so, am I upset if Great River, makes some money? No, I want them to. Are they going to be upset if Henry County Health Center makes money? No, because we are a partner. We're going into a partnership, and we're there to make each other stronger. And, my example of, the critical access reimbursement being higher than, for certain procedures, it may make sense because we would be more profitable here. It would make sense for Great River to actually send people or do those procedures here, which is, that just stresses what a partnership is. We both have to benefit, and that's what the Board of Trustees has worked so hard to create, and that's why we're excited about it.
Great. I want to remind our listeners that they can ask a question by hitting *3 on their phone. Just hit *3 and we'll get you in for a question. I did have just a kind of a follow-up or a little bit more of an exploration question here. This one came from Marlis, and Marlis is asking about just why is the full lease not available, and why have folks been asked to sign a non-disclosure in order to see the lease?
Well, I'll sure start with that. A lease is a legal agreement. Bottom line. We have been working on this for 18 months. We've had attorneys on both sides. Attorneys are much smarter on the stuff, on the legal stuff than I am. But I can knock their socks off on the numbers any day. So the lease is proprietary. The lease has things that are proprietary for Great River and for Henry County Health Center. I think the fact that the lease is currently not available, well, it is available. All you have to do is sign the non-disclosure. You can read it. We've come up with a great summary of points, and we have made ourselves available because every single board member is aware of everything in that lease. We have read it, we have studied it, we have worked on it, we have negotiated it. And all of the Board of Trustees is available to answer any question. Because what this vote's about, really, the vote's not about approving the lease. The vote is about authorizing the Board of Trustees, who are your elected officials, to enter into this lease agreement. It's our responsibility. You have every reason, every right to want to see it and to know what's in it. But that is what we are here for. That's what we were elected to do. We are comfortable with the lease. Not only comfortable, we're excited about it, and we're excited to move forward with it. Hopefully that answers your question.
Thank you, Jan. And looks like we've got time here probably just for this one more caller that's in our queue. And let's see, it looks like David has a question about Great River Health. David, you are
here on the line.
Live. Yeah, go ahead, David.
I was wanting to ask Mr. Wenzel about Great River. Who does Great River operate as a nonprofit or for-profit? Who are the stakeholders and own the Great River? Is it traded publicly, or is it an entity like Henry County Health Center owned by the public?
Thanks for the question. It's a good one. So it's a not-for-profit owned by the community, but we are not county-owned. We're a private not-for-profit. So our Board of Trustees, unlike Henry County Health Centers that are elected by you, the community, because the bricks and mortar and the operation are the counties, we are a private, like I said, not-for-profit. So the not-for-profit status is essentially the shareholders, if there was such a thing, are the Board of Trustees. They're all volunteers. Nobody profits from this. How it works is that our fiduciary responsibility is to make money so that we can reinvest it back into employees, back into capital, and back into the community. So unlike a private for-profit, where their fiduciary responsibility is to maximize shareholder wealth, ours is to maximize our community, which gets back to the question a little bit ago about EMS. That's how we're able to do this. Because if we were a private for-profit, you better believe there's no way that our shareholders would be giving money back into the community like we're talking. This is why we're here, to benefit Southeast Iowa.
Well, thanks for that answer, Matt. And we're now at the point in the program where we're going to start to tie things up. I want to make sure that folks understand that they have 2 days yet to vote on this important matter. On Monday, you can vote at the Henry County Courthouse between 8 a.m. and 4:30 p.m. Just go in the main doors, and there are signs directing you on where you can go and cast your ballot early. So that's tomorrow, Monday, March 1st. You can vote between 8 a.m. and 4:30 p.m. at the courthouse. On Tuesday, the polls are open from 7 a.m. to 4:30 p.m. Polling locations are posted on the campaign's website, which is HCHC.org. They are also available at the county auditor's office. And I want to make sure that folks know that phone number is 319-385-0756 if you have any questions about the where you should be voting. And I'm going to kick it to the two of you to offer up any closing remarks you might have. Jan, why don't you go ahead and go first?
Okay. Matt and I were just drawing straws, and so I guess you made that decision for us. So, well, I would like to just thank everybody for being on the call tonight, first of all. Really encourage you to vote on, well, Monday or Tuesday. And, you know, I just want to maybe summarize for me. And I think I can speak for the entire board that we have done our due diligence. We have taken the time to study every facet of this lease. We have been transparent from the very start. It has been on our agenda for 4 months. We have done everything we can to get the word out. We have opened ourselves up to questions, and I continue to open myself and the rest of the board up for questions. So please, you know, vote. It's important to Southeast Iowa, but please get the facts. If you have any questions, please contact the hospital. They've got all of my information, all the trustees' information. It's not too late to get your questions answered just because our call is going to be over tonight. But thanks again for tying in.
And I would add if you have questions, again, as Jan said, please reach out. I'll be around tomorrow at Henry County. Board of Trustees, by virtue of living here, will be around. We want to make sure that people make the best decision. That only comes when you know the information. If you've got a question, please reach out and get the facts. And for me, and I think that Jan summarized this well, for me, this is about stabilization of healthcare, stabilization of employees and jobs in this community and all of Southeast Iowa. We are Southeast Iowa, and we want to take care of Southeast Iowa, period. That's what this is. So, again, respect everyone who came to listen on a Sunday night. Really appreciate that. So hopefully we were able to get some questions that you had answered. Thank you.
You bet, and thank you both for taking the time for this. I think it was a good conversation, really great questions from our listeners. Folks, if you have questions and you want them answered, you can go to HCHC.org. There are many different ways to connect with us there, including via email. You can also go to the Vote Yes HCHC Facebook page if you would like to participate in the conversation there. We want to make sure that we're doing all we can to answer questions. And once again, I just want to say the polls are open on Tuesday from 7 a.m. to 4:30, from 7 a.m. to 8 p.m. on Tuesday. And those polling locations are listed at voteyeshchc.org. If you would like to get your vote checked off tomorrow on Monday the 1st, you can do so at the Henry County Courthouse between 8 a.m. and 4:30 p.m. At the courthouse. We do hope the folks get out and vote. It's an important way to make your voice heard, and we certainly appreciate everyone's time tonight and for a very good and robust dialogue on this. So on behalf of all the participants and the folks at our Good Call Center here, we want to thank you and wish you a very good evening. Thank you and good night.